Hello, I'm Katrina Huseman. I'm a family nurse practitioner student. I'll be performing your assessment today. I'd like to start by washing my hands. Can you tell me your name?
John,
And how old are you?
87.
Okay, and what brings you in today?
Well, I was working around the house and I felt just a little weak.
Okay, in what way do you feel weak? Are you not as strong as you used to be? Are you not able to do activities as long as you used to? Or what's going on?
I'm not as strong as I used to be
Okay, how can you tell?
because I feel just moving slow. I'm just moving slow.
Okay, and when did you first notice this?
Just a little while ago, about an hour ago.
Okay, what were you doing when you noticed it?
Oh, I was just cleaning up around the house.
All right, and has this been going on since you noticed it, or is it coming and going?
It's happened since it happened.
Okay. Is there any particular location where you feel weak? Like, is it your legs or your arms or both, or is it in general?
Both in general.
Okay. So, and you said it came on suddenly earlier this morning. Is there anything that you're doing that you think might be making it worse or better?
I don't think so. I think it just happened.
Okay.
Just came out of the blue.
All right. On a scale of 1 to 10, with 10 being the weakest you could imagine yourself being, how weak do you feel?
9.
Okay. Have you been around anyone that's been sick recently?
Oh, no.
You know anyone else that's having some weakness issues as well? Have you been sick recently with a cold?
No, I haven't.
Any recent surgeries or procedures?
Nope.
Any recent diagnostic testing?
No, nothing.
Any shots or immunizations?
Nope.
Okay. Tell me about your past medical history. Do you have high blood pressure?
I have high blood pressure.
Any heart rhythm issues?
Yes.
Which do you have?
AFib.
Do you have high cholesterol?
Yes.
Okay. Any other health concerns?
No, I don't think so.
Have you ever had surgery?
No.
That's pretty good for an 80-year-old. What about your family history? Has anyone ever had a stroke? Your parents or siblings?
Yes, my parents.
Okay, what about diabetes?
Yes.
Heart disease?
Yes.
Can you tell me which family members had those conditions?
Parents and my older brother, Jim.
Okay, is Jim still with us?
No.
Okay. Did anyone have cancer?
Cancer? No.
Brain cancer?
No, no brain cancer.
Okay. When was your last eye exam?
4 months ago.
Okay, and how was that?
Went well.
All right. Have you had your colonoscopy within the last 5 or 10 years?
No, I haven't.
Okay. When was the last time you saw your primary care doctor?
I haven't.
Okay. Are you able to tell me what medications you take?
No.
If I read them off to you, would you be able to tell me if you're taking those or not?
I think I could.
Okay. Do you still take warfarin?
Yes, warfarin.
Okay. There's a couple blood pressure medications here. Do you still take metoprolol?
Yes.
Okay. What about lisinopril?
Yes.
Simvastatin?
Yes.
Aspirin?
Yes.
Okay. Protonix?
Yes.
Okay. Have you missed any doses of your medicines?
Well, just last night I fell asleep on the couch. And I missed my dose. But that was the only one.
Okay. Have you missed medications before?
Well, yes, occasionally.
You said, we mentioned that you take warfarin. When was the last time that you checked your INR?
3 weeks.
Okay. Was that normal?
No.
Low?
It was low.
Okay. Do you have any allergies to medications?
I don't think I do.
Do you smoke?
Yes.
How much do you smoke?
1 to 2 packs a day.
How long have you been smoking?
Oh, for years.
Okay. Since childhood?
Yes.
What do you say? Were you about 15 when you started?
About 11. I grew up on a farm.
Okay. Do you drink alcohol?
Yes.
What do you drink?
We have whiskey, neat.
How many drinks do you have a night?
Oh, just 3 or 4.
Okay. Are you working?
Oh no, I'm retired.
All right. Are you married?
Oh, I was widowed.
Okay. Sorry to hear that. Do you have a significant other? Any local support system?
No, just the whiskey.
Okay. Tell me about your lifestyle habits. What kind of diet do you follow?
Oh, I eat a lot of fast food. I eat out a lot. Ever since my wife died, I just go out to eat. She did all the cooking, and I never learned how.
Okay. Do you exercise?
No, I wouldn't call it exercise. Just cleaning up around the house.
All right. Do you have any pets?
Oh no.
Have you,
Mary Beth was allergic to cats, so we never got them.
have you traveled recently?
No, I don't got anywhere to go.
Okay. We're going to go down some symptoms here in different body systems. You can just tell me if you feel like you've been noticing these or not recently. Have you noticed any weakness?
Mm-hmm.
Have you been tired?
Yeah, I'd say.
Any change in your appetite?
No. I'm
Any
still hungry.
Any fevers?
No.
Weight changes, gain or loss?
Oh no, I'm pretty steady.
Do you sweat at night?
No.
Okay. Have you had any trouble concentrating?
No.
Any dizziness?
No.
We already talked about weakness. Have you been lightheaded?
No.
Have you noticed any loss of balance?
No.
Any numbness?
No, I don't think so.
Have you had any chest pain?
No.
Shortness of breath?
No.
Do you notice an irregular heartbeat when you're in AFib?
No.
Okay. Have you ever passed out or nearly passed out?
No.
Any palpitations?
No.
Any swelling anywhere that you know of?
No.
Alright. Have you noticed a cough?
No.
Any shortness of breath
No.
in general? Any trouble sleeping?
No.
Do you snore?
Oh, I think so.
Have you been nauseated?
No.
Any vomiting?
No.
Any difficulty chewing or swallowing your food?
No.
Have you noticed any blood in your spit or your stools?
Mm-mm.
Okay. I see here that your vital signs are abnormal. Blood pressure is high at 170 over 110. Your pulse is fast at 131. Your respiratory rate was 18. Your oxygen saturation was 98%, and your temperature was 98.9 degrees Fahrenheit. So, based on the current part of the interview, I've stopped what I was doing and assessed the FAST measurements to make sure that he's not having a stroke, which in this case, for the sake of the video, we're going to proceed with the full neurological exam, but based on his positioning with the left weakness, I can see that his face is slightly paralyzed and he's not raising his arm, he's not resting it. We would probably go ahead and call 911, but while we're waiting on an ambulance, we could proceed with the rest of the neurological exam. So the patient is awake and alert. He appears to have a flat affect. He's not making much emotional connections. He did have appropriate responses to the questions. It seems like he was maybe forgetful or wasn't quite sure of the answers at times. And then we did establish that he is oriented when we started, and his answers do show that he knows what's going on. So we'll go ahead and start with the assessment of you. We'll start by looking at your eyes. Just going to stand off to the side here. I'm going to wiggle my fingers. I'd like you to let me know when you see my fingers. Okay? You see fingers?
I see one.
Okay, let me know when you see both my hands.
Yes.
Okay, going to do this again on the other play here. You see fingers?
I see one.
Okay, let me know when you see two.
Yes.
Okay, so his visual fields are showing a deficit completely on the left side. Now we're going to move on to looking at the pupils. If you could just look straight ahead, I'm going to shine a light in your eye twice. The pupils are equal. They're 4 millimeters in diameter and they are round. Okay, here we go. Just look straight ahead. I'm going to shine it twice in each eye. Okay, now if you can follow my finger into your nose. Good. So they were equally reactive to direct and indirect light and accommodation. This tells me that there's not any current brain damage just yet. It might be an acute episode here. We might be catching the stroke early enough. Next we're going to test for eye movements. I'm going to start in the middle here and have you follow my finger. Okay, so he did have appropriate vision, smooth conjugate movements on the right side. There was no nystagmus or lid lags, but his eyes did not track to the left, which also demonstrates the visual field loss. Okay, next we're going to move on to your facial strength. If you could raise your eyebrows, okay, and smile, and puff out your cheeks. So there is asymmetrical facial movement. The left side of his face is not moving at all in comparison to the right side of the face. We'll now test for sensation. Does it feel the same here as here?
No, I felt one.
Okay, what about here and here?
No, just one.
Okay.
Just one.
Okay, he says absent facial sensation on the left. This is consistent with our recent findings of him having the left side neglect. Okay, we'll now move on to testing the hearing. So I'm going to stand on your side and cover your other ear and whisper a number, a letter, and a number, and I'll have you read those back to me. Okay, just going to reach around here.
H1.
Okay, that's correct. Now we'll move on to the other side. Okay, he's failed the hearing test on the left side, but he did pass all 3 letter number combination, or was correct on the right. We'll now move on to the motor system. I'm going to test your strength. I'll have you just resist. I'm going to push down your shoulders. I'd like you to push up. Okay. He's got good shoulder strength resistance on the right and absent shoulder shrug resistance on the left. There was no movement there. I'd like you to hold out your arms. Okay. And then, so he does not appear to be able to move his left arm. I'm going to raise it. Okay, and the arm is flaccid. It's not able to stand against any gravity. It just went right back down. Okay, and have you push against my arms. Just push down. There you go. And we'll try to do this over here as well. Push down with your arm. The arm is flaccid. There's no response there. We'll do the same thing with your wrists. Have you push down against my hand. Okay. Try the same thing over here. Okay, and no response. We'll move down to the legs here. Put your legs up forward. You could push your feet up against my resistance. Okay, there's good, strong movement against resistance on the right side and no movement on the left. And then I'll have you get under your feet here and have you push your feet down. Okay. There's a strong response to resistance on the right, and there's no movement. It's flaccid on the left side as well. Okay, now with his current state, I don't think it would be safe to test his gait, but what we would do is do a casual gait test, then the heel walk, a toe walk, and then a tandem walk as well to just evaluate his response to balance. But with him not being able to hold up his right and left side, I don't think it would be safe to do that with him here. Next, we're going to test coordination. If you could try to move your fingers on both sides along your thumb. Okay. He has good fine finger motor movements on the right and is absent on the left. We'll now also have you take your fingers and move them to your nose and alternate your arms. Okay. The patient's able to do the finger to the nose appropriately on the right and is unaware that he is not doing that on the left side. What I'd like to do also is have you, if you can do this while you're sitting, take your right heel and put it to your left knee and move it down your shin. Okay, that was good. Can you do that with your other leg? Nope. He's able to do the heel, knee to shin on the right, using the right foot onto the left side, but not on the left. And it wasn't full contact over here. He was just able to kind of move it and reach it, but he wasn't able to make contact since he's not aware of his left side. So now we're going to test for proprioception. So if you could close your eyes. I'm going to wiggle your toe, and I just want you to tell me if your toe is going up or down.
Up, down, up.
Okay, and now? Okay, the patient was not able to detect proprioception on the left, but he is able to correctly identify proprioception on the right. Next, what we'll do is move on to testing the reflexes. I'll be using my stethoscope to do this. I'm going to start by having you rest your arm out like this. Just relax your hand. Okay, there was a 2+ reflex response there. That is normal. I'm going to move on to this side. There was a 1+ hyporeflexive response on the left. Now do this on the patellar reflex. Okay, there was 2+ muscle response there with the reflex. That's normal. And 1+ hyporeflexive response there. We'll now also test the Achilles reflex, and I'll do that by supporting his foot here. Okay, there's a 2+ response there. Now do the same thing here. 1+ hyporeflexive response was noted on the left. We'll now move on to just taking a listen to his heart and his lungs. I'm going to raise your shirt if that's all right with you, just so I can get a better listen. Start with the aortic point. Melodic, herbs, nitro, custard. Okay. S1 and S2 were noted throughout. There were no murmurs or gallops, but the rhythm is irregular, which supports his fast pulse and his history of AFib. Now listen to the bell. Aortic, pneumonic, S1 and S2 were noted throughout. There were no murmurs or gallops, and continued irregular rhythm was noted. We'll now listen to the lungs. Start with your neck. If you can just take a breath in and out each time I place my stethoscope. Thank you. Breath in and out. Good. And lift up your shirt again. Breath in and out. 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 In In and out. Breath in and out. Breath in and out. In and out. In and out. Good. If you could sit forward slightly. Raise your shirt in the back. Listen to your lungs from the back. In and out. 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 Okay, two more. In and out. In and out. Good. You can lean back. The lung sounds were clear to auscultation. There were no adventitious breath sounds noted on the anterior and the posterior chest. Now in terms of diagnoses and differential diagnoses, the patient is having an acute stroke. This is supported by his risk factors. He's got AFib, hypertension, coronary artery disease. He's a smoker. He's also got hyperlipidemia. He's missed doses of his medication. His last INR with his warfarin was low and he hasn't rechecked it, and then he's missed doses last night. Also, it's a sudden unilateral weakness with a positive visual field loss. He's got left side neglect, and he's unaware of that in terms of the assessment, and then he's also got some sensory loss on that side. So, thinking back to the history and physical interview, when I walked in the room, if I would have seen him positioned that way, not supporting his left side, I would probably stop what I was doing, do the fast assessment, and then just promptly call 911. I wouldn't have waited through the interview, but still gotten that information in the process of calling for help and calling 911. Another possible diagnosis could have been Guillain-Barré syndrome. However, this was not a progressive onset, and it didn't go distal to proximal. It was just completely on one side. He also hasn't had any recent illnesses, procedures, or immunizations, and he did have asymmetrical weakness versus a symmetrical progressive weakness that's characteristic with that. And a third possible diagnosis could be a spinal cord tumor, but this is his weakness was in the upper and lower extremities on one side. It was not gradual, it's not chronic, and then there's no cancer history in the family. So this concludes our assessment video. Thank you.